The topic I've chosen is the disease of Alzheimer's, and the instrument that I have decided to cover is the MMSE, also known as the Mini Mental State Exam, and it is used to test cognitive function among the elderly, usually 65 and over. It includes tests of orientation, attention, memory, language, and visual spatial skills. The test was first published in 1975 as an appendix to an article written by Marshall Fulstein, Susan Fulstein, and Paul McHugh. It was published in the Journal of Psychiatric Research. The nature of the test itself is to identify early onset Alzheimer's and any cognitive decline along with physical inability that someone may face. The reason the early onset is important to detect is because Alzheimer's is the leading disease as far as causing major mental illness and disability among the elderly, and the one that follows it directly is dementia. So if it's possible to identify these signs of cognitive decrease early enough, then there may be treatment available. This test does have cutoffs, so the normal score would fall between 24 to 30 if you have no cognitive impairment, 18 to 23 if you have mild impairment, and then 0 to 17 if you have severe impairment. But the cutoffs have to do with your grade level. So if you have a 7th grade education or lower, and then all the way up to college or higher, then your grades kind of change. Your scores can vary before they become significant, or an issue of cognitive impairment may be present. And those range from 22 or below for 7th grade and 26 or below for college or higher degrees. So the test itself, the instrument has 11 questions, and within the question it has multiple other smaller questions with a total score being of 30 available that you can get, and you get 1 point per question that you get right. Some disadvantages of it is that it can be difficult to identify mild cognitive impairment, as well as identifying differences in severe cases of dementia. Also, age, education, cultural and social economic background can cause biases in terms of ability to answer certain questions, or biases of the scores themselves. The advantage is that it's pretty quick, so it probably takes 10, maybe 12 minutes max to answer all of the questions. If you know them all, then you know them. If you don't, you don't. So it's kind of easy to go through it. Another advantage is that the test is free, so it doesn't have a cost associated with it. It's readily available online. You can buy a manual along with it to help score better, but it's not necessary, and that manual can vary from $80 to a few $100s just for the manual, but the test itself is free. You can find it online. Another good thing is that aside from it being fast, it also has good validity scores. So it has excellent concurrent validity, internal validity, and convergent validity that kind of back it up as being a good test for identifying these issues. alternatives. One alternative I found is the MOCA, and that one just takes longer, is really the difference, and then the scoring is a little more complex than the MMSE. And then personal critique, I like it. I think it's effective, it's free, and then also it does a good job of having the cutoffs, which allow for various grade levels and education levels. And the only drawbacks, I think, would be the socioeconomic backgrounds and education and cultural differences that may impair the giving of the test or the scoring of the test. So that's it.